Let us now go to interview and history taking strategies. The topic is components of the comprehensive health history. When writing down the chief complaint of a patient, use their own words to describe the reason for their visit. Ask the patient to tell you why they sought care. For example, Mrs. Brown, what brings you to the office today? Record the patient's response using her actual words. Do not rephrase the stated reason using medical terminology. For example, the correct way of saying it is, I've had a runny nose and sore throat for 3 days. The incorrect way is writing, patient states that she has experienced coryza and pharyngitis for 3 days. These data represent an amplification of the patient's reason for seeking care. The thoroughness and quality of the data in the history of present illness are the driving forces in determining which systems the clinician will focus on in the review of systems and subsequent physical examination. This judgment requires that the clinician think critically in analyzing the data and apply evidence-based research findings. The goal in obtaining the history of present illness is to get a comprehensive description of the characteristics and progression of symptoms for which the patient seeks care. For several decades, clinicians have used the mnemonic device PQRST to help ensure that all the necessary data are gathered regarding the patient's presenting symptoms. P is precipitating factors. What provokes the symptom? Q is quality. Describe the character and location of symptoms. R is radiation. Does the symptom radiate to the other areas of the body? S is severity. Ask the patient to quantify the symptom on a scale of 0 to 10, with 0 being absence of the symptom and 10 being the most intense. T is timing. Inquire about the onset, duration, frequency, etc. Although PQRST is useful in accurately describing symptoms, it does not capture many of the elements of health and illness as experienced by the patient. The following mnemonic device integrates ethnocultural considerations into the data gathering process and facilitates the provision of culturally congruent care. It also serves as a reminder to clinicians that patient outcomes determine whether an acceptable standard of care has been met. Successful outcomes are inextricably linked to care that is culturally and linguistically competent. The mnemonic device is client outcomes. C is character of the symptoms, including intensity and severity. L is location, including radiation if present. I is impact of the symptoms or illness on patients' activities of daily living and quality of life. E is expectation of the caregiving process. N is neglect or abuse, including any signs that physical and emotional neglect or abuse plays a role in the patient's condition. T is timing, including onset, duration, and frequency of symptoms. O is other symptoms that occur in association with a major presenting symptom. U is understanding or the belief about the possible causation of the illness or condition. T is treatment, medications, and other therapies that the patient has used to try to alleviate the symptoms or the condition. C is complementary alternative medicine, including a description of the patient's use of these agents or practices. O is options for care that are important to the patient. M is modulating factors, meaning factors that precipitate, aggravate, or alleviate the patient's symptoms or condition. E is exposure to infectious agents or toxic materials. S is spirituality, including spiritual beliefs, values, and needs of the patient. Thank you so much for your attention.